Cancer, heart disease, Alzheimer's. Why do some diseases still plague us? And can we cure them? Let's start with cancer. There were over 1.5 million new cancer diagnoses in the US in 2015 alone, but we are making progress. Science has allowed us to target cancer's genetic roots, and that can lead to therapies that attack the way cancer grows. But there are still problems. Treatments can cost hundreds of thousands of dollars per patient per year, and many treatments can cause severe side effects. So what's next? Science will focus on treatments individualized for each patient, and new drugs are boosting our own immune systems to turn them into a cancer attack system. Heart disease is still the leading cause of death in the US, but the number who die from it has plummeted in recent years. So can we get to zero deaths? Probably not. Lifestyle choices like the food we eat and whether or not we smoke can significantly increase our risk for heart disease, and medicine can't fix bad habits. But science can help when it comes to new drugs that break up blockages, surgeries to replace bad heart valves, and imaging to see trouble early. Has science improved our odds against Alzheimer's? We can image the buildup of protein deposits called beta amyloid plaques, and we're able to see them when a patient is alive. This might be a way to fight the buildup before it's too late. But problems remain. Many drugs developed to target the plaques have failed or have only been promising in lab animals, not humans. But one drug from the company Biogen had some promising results in a small human trial. The drug needs to be tested on a larger scale. Another chronic brain condition is Parkinson's. The main symptoms are tremors, rigidity, slow movement, and balance problems. So how is science tackling the disease right now? Better drugs help manage symptoms. Scientists are also learning more about how the disease works, including the genetic triggers that can increase a person's risk for developing it. But Parkinson's is still an incurable disease, and there's no treatment that can even slow its progression. In the coming years, research will focus on developing drugs to fight protein clumps called alpha-synucleins that can lead to the disease. In the last 30 years, science has transformed AIDS from a death sentence to a chronic condition managed by medication. The yearly death toll used to be a lot higher. So what's changed? There are now 25 different antiretroviral drugs available to suppress the virus. But even if we're able to hold AIDS largely at bay, the virus is still able to hide at very low levels in the body. If researchers can find a way to bait the camouflaged virus out of hiding, then perhaps AIDS could be a disease of the past. But we're not there yet. Will we conquer any of the toughest diseases in the next few years or decades? Stay tuned.